There's three of the most common skin cancers we see. There are a few others, but the most common ones that we see are basal cell carcinoma, squamous cell carcinoma, and then melanoma. Basal cell is by far the most common cancer. This really affects almost 20 to 25% of the population. It's that common. We see it every day. It typically occurs in sun-exposed areas, and a lot of times it looks like a little shiny pink bump, and it's typically on the the scalp or the face, the ears, the areas where you've got a lot of sun exposure. Squamous cell is the second most common, and it can look a little more warty or scaly and crusty, and it's usually kind of a little bump or lump that's scaly, and it doesn't typically just go away. And lastly, there's melanoma. Thankfully, it's not very, very common compared to the other two, but it is the most dangerous and potentially life-threatening skin cancer. That comes from mole cells, so it comes from cells that produce pigment. So a lot of times melanomas, you see them as brown or dark black spots that change shape or colors or size.